your chair massage, what you're going to do is you've got to give your client a disposable hair band that they're going to tie their hair up with. And these are quite gentle on the hair. They're not going to pull it. Just that we have access, and that when I need to do work on the neck area that I have access. So before you start your chair massage, it's really important that your posture is really good. Feet slightly apart and knees slightly bent. We're going to start off by walking down the back, putting pressure into your palmar surface and moving back, that you're positioned and your weight is evenly distributed. We're going to warm the body up by shaking. Next movement is the catwalk down either side of the spine. Again, pressure, whole body pressure into the whole of your hand, bending your knees slightly. If needs be, you may go on one knee, taking into account you do not want to injure yourself. We're going to do kneading on the trapezius, and this can be together, or we can do alternate, where you're lifting up the trapezius either side singularly. Lift up over the deltoids and lifting up on the upper arm. You can always break up movements with nice light effleurage. We're now going to use the pads of our fingers, and we're working from the occipital bone right down to the sacrum, putting pressure into the pads of our fingers in a piano movement, making sure that you don't work directly over the spine, that it's either side on this like raised area. So piano, putting pressure into the pads, nice movements connecting up, the whole way down the spine. And you can repeat this 2 to 3 times. We're now going to move on to the knuckling, and we're moving from the spine to the lateral side of the body, making sure that we do not put any pressure on the scapula or on the bra area here. If they've got a fastener, do not press in, as this will hurt your client and cause pain. Push to the side, moving your right hand. If you have a larger client and you need to put extra pressure, you can reinforce by putting your elbow onto your hip bone and pushing forwards. Again, making sure that your own knees are bent to avoid injury. Coming back up, and you're going to repeat on the opposite side. So to work on the neck area, it doesn't feel very nice to have skin on skin. So what I'm going to do is put minimal amount of oil just to lubricate, and just that it feels nicer for both you and your client. So make sure you don't get it into the client's hair, so move away and just nice and gently. What we're going to do is just nice movements up either side, right into the little socket in here of the occipital bone, making sure that the bone or the skull along here, that you meet that as well. Now we're going to do thumb press and slide. So, thumb, press and slide. Thumb, press and slide. Thumb, press and slide. And making sure that we get to this bone underneath here and nice pressure points along the base of the skull. Moving your hands gently up onto the client's head, again making sure we don't want to put oil in their hair, so we're just going to do nice firm pressure points. What you must avoid is this kind of a friction movement. You really need to move the tissue over the skull. And connecting up, hand on client's head, just move along. And we're now going to move on to our percussion movements. So moving on to our hacking, this can be either side of the spine, down either hand, upper arm, onto the trapezius, the deltoids, the other side, down on the glutes. And this can change that we do it double-handed. And this is also quite nice to be reinforced. Do be careful when you're working over the internal organs that there's not additional pressure. You do not want to hurt anybody by putting excess pressure on that area. You can also use your elbow, place either side of the spine and use a hinge-like action. And this also feels really nice for your client. And if you're somebody who cannot get good pressure into your hands, this helps you. Change hands. Position yourself that you're comfortable and repeat hinge-like movements. Walking back up the spine. Onto the trapezius and nice lifting movements. Out over the deltoids, lift, out over the upper arm. Connecting up, and now we're going to do our arm movements. We're going to shake the upper arm, and then we're going to very gently lift, and we're going to work from the elbow down the arm. So you can do rotaries, or you can do thumb glides, which is equally nice, up to the elbow. Making sure that you do the outer, so the inner, the middle and the outer arm. Working on the carpals, knuckling on your palmar surface, turning your client's hand over, nice frictions along the upper metatarsals, metacarpals, and then nice rotaries up each individual finger. Hold. And just in this little space here, it feels quite nice just to put a little bit of pressure. Hold and pull, and repeat on all the fingers. Place your hand back gently and walk to the opposite side, where you're going to repeat the same movements on the opposite side. So to finish your routine, you want to close down the body and just do nice stroking movements using the whole of your hand to cover all the areas of the back. Gradually, the strokes may get longer and lighter. And now we're going to just very gently come down the spine, Pressure on the trapezius. Lift up the deltoids and resting